So Andrew will be talking about CBT and using CBT for dealing with trauma for children, adolescents and adults. And I'll tell you the secret. First, we've approached him and I asked him if he would do a complex trauma seminar for us. And Andrew said, well, I would like to change the title a little bit. So I will ask Andrew to explain whether the term complex trauma is appropriate and in what situations we can use it or maybe shouldn't use it. So if that's something what is of interest to you, also please just write it in the chat box. And if you want to clarify these things further, then please ask Andrew.
So I guess in terms of starting off, Andrew, we might as well pick up this question that Julia put out, you know, a little while ago, which is this sort of trauma, complex trauma idea. And maybe you could just share a few thoughts on that and the distinction and what you think of the terminology and so on and so forth.
Yeah, it would be a real pleasure, Paul. And first of all, I want to say I've done a lot of work with your organisation in the past, but when the opportunity to do this one came up, it was the one that I was absolutely blazing with enthusiasm to do for a whole bunch of reasons that I hope I'll get a chance to talk to you about this evening. But it's a topic that's really important to me as a practitioner. And I suppose you start off with that really tough question about the terms that we use to describe the incredibly tough things that happen to people and how that then shapes our understanding of how we might help them. So so when we talk about trauma in the field of mental health, trauma just describes the very tough things that happen to people during their lives, and whether that's during their childhood. So I worked in CAMS for 20 years, so I saw a lot of children who'd experienced very tough times, or during adulthood, and I've done maybe 6 years in adult mental health services, so I'm kind of more familiar with trauma in children, but also working in adult services too. So trauma is just a description of something tough that's happened, but it's become a really pervasive term in mental health services to describe how we understand how people are right here at this moment in their lives, and an explanation for how they're doing right now that comes from the tough things that's happened to them in the past. So often when we talk about, you know, I've got a particular interest in working with trauma, or our service takes trauma into account, it's a way of saying we recognise that people's pasts, their current lives, and how they're doing in this moment. Now, that term is sometimes used interchangeably with this idea of complex trauma, that if someone says, I'm interested in working with people with complex trauma, or our service thinks about complex trauma a lot, what that tends to mean, although the definitions are a little bit vague in how they're often used, is I'm interested in working or aware of how to work with people who've had multiple really tough things that's happened to them. Sometimes they're the same kind of things, but sometimes they're different kind of things, and experiencing one kind of trauma actually increases your lifetime risk of other traumas as well. So complex trauma is just a way of kind of framing a kind of tough life over a long period of time, and that can also be used to suggest that this is someone whose ability to work with services, to settle into therapy, to trust you as a therapist, has been impaired and impacted by that. So I think those two terms are kind of used a little bit interchangeably, but in some ways reflect a difference of degrees. Now, to make it even more complicated, there are some diagnostic frameworks that are used to describe the consequences of these tough life events. So post-traumatic stress disorder is one of them. And post-traumatic stress disorder, PTSD, is the experience of having something tough happening to you in the past that feels as though it's happening in the present because of intrusive thoughts, emotions, imagery of what happened. And complex PTSD, which again is often used a little bit interchangeably with complex trauma, is when lots of really tough things have happened, and that not only results in these intrusions, but also sets up pervasive patterns in your life that make life particularly difficult. Now, just to make it even more complicated, Paul, it's that those terms have been used as an alternative to a more psychiatric and diagnostic framework like borderline personality disorder. Now, borderline personality disorder was a term that was kind of really quite pervasive when I first started working in mental health services in the early 90s, and became kind of more pervasive over that kind of decade. And then there was a big pushback against it, mainly through service users, but also through mental health professionals, beginning to recognize that it wasn't a useful term and framework for many of the people who ended up with that diagnosis, and that it didn't really take into account their struggles and their lived experience. So then what happened is that kind of service users or clients or therapy participants who may have been referred to as having borderline personality disorder at one point then began to be described as having complex trauma or sometimes complex PTSD. So we're left with several competing descriptive systems to talk about how people's tough lives have impacted them right now in the present. But what all those kind of descriptions have in common is that there are practical therapeutic approaches and techniques that people can pick up and use right now that will make a significant difference to people's functioning. And so why I was really keen on doing this, part of the reason is that I think sometimes people feel a little bit disempowered around working with trauma, working with complex trauma, working with complex PTSD. But in fact, it's really treatable as a condition, as a set of problems, provided you've got the right set of tools. And so I'm kind of really keen on disseminating that and empowering people to feel like they can work with whatever you call it, complex trauma or complex PTSD, in a confident and evidence-based manner. So, Paul, were you expecting that long an answer? I went on there. I really went on. That was like a keynote address. I'm sorry about that.